Moffitt Cancer Center is located on the University of South Florida campus in Tampa, Florida. While there are many ways to get to the USF campus, the following directions guide you from Fletcher Avenue. From Fletcher Avenue, proceed south on USF Magnolia Drive. Moffitt Cancer Center is on the west side of the intersection of USF Magnolia Drive and USF Citrus Drive. When you arrive, turn right into the main Moffitt entrance and follow the signs for the Gold Valet. There is never a charge for valet parking services at Moffitt Cancer Center. Moffitt's valet team is accustomed to serving visitors at the Cancer Center, so if you need assistance exiting your vehicle, please do not hesitate to ask. Wheelchairs are available for patient and family use. When planning your visit to Moffitt, we suggest adding an extra 15 minutes to your commute to allow for traffic, a minimal wait in the valet line, and time for elevators and the short walk to the BMT clinic. As you enter the Moffitt Clinic building atrium, there is an information desk with staff available to answer any questions you may have. Proceed to the right toward Elevator A. You will pass Common Grounds Coffee Shop as well as the public restrooms. Continue to the end of the hallway and take Elevator A to the 4th floor where the Blood and Marrow Transplant Clinic is located. We also call this BMT. When you exit the elevator, turn left to enter the BMT clinic. Before entering the BMT clinic, you and anyone with you are required to sanitize your hands. This is to ensure the health of you, your family, and other Moffitt patients by helping to prevent infection. A hand sanitizer dispenser is provided for your use at the clinic door. The clinic door is automated to assist with entry. Welcome to the BMT Clinic and Treatment Center. You have been scheduled to see a BMT doctor because your disease may be treated with a transplant. This video contains important information about your first BMT appointment. We hope this will help you better prepare for your upcoming visit to the BMT Clinic. This is where your journey begins, and we are here to guide your every step. Moffitt Cancer Center prides itself on using a patient-centered, multi-specialty, team-based approach to cancer care, providing each patient support through their journey. Your team of doctors, nurses, pharmacists, and other medical professionals will work directly with you and your caregivers to ensure you receive superior medical treatment designed specifically for you. Prior to your appointment, a packet containing information about your upcoming visit will be sent to you by either U.S. mail or email. How you will receive your packet is confirmed by the new patient scheduler when scheduling your appointment. Follow the instructions provided in the packet to use your Moffitt Patient Portal, where you can complete the electronic patient questionnaire. If you cannot complete the questionnaire before your appointment, we ask that you arrive 1 hour early on the day of your appointment so we can help you complete it. The patient portal is designed to provide additional assistance and information for you and your family regarding your care at Moffitt. Your first clinic appointment is called a consult appointment. It will be 3 to 4 hours in length as we get to know you as a patient and answer any questions you may have. It is important that you arrive on time for this appointment. However, unless you need assistance completing the questionnaire in the patient portal, you should not arrive too early as this will add wait time to your day. Be sure to dress comfortably and bring a photo ID as well as your health insurance card and a list of current medications. Coffee and ice water are available in our waiting area, and our staff can bring you drinks or snacks if you like. We suggest bringing a pen and paper to take notes, and we encourage you to travel with an adult family member or friend who can assist you with both note-taking and remembering what is discussed. Bringing a list of questions you may have with you is also a great idea. Please bring reading materials or a quiet activity in the event of an unexpected wait. You may also bring medications, water, and snacks. The Common Grounds Coffee Shop is located on the first floor of the clinic building, and the Moffitt Cafeteria is located in the basement of the main hospital. All new patients are given a tour of the clinic by one of our many certified medical assistants. To prevent the spread of infection to our patients, children under the age of 13 are not permitted inside the BMT clinic and treatment center areas. We do not have facilities for young children to wait. The consult appointment is your first visit with the BMT team. You will meet with BMT staff to discuss transplant as a possible treatment for your condition. Please keep in mind that this appointment will be at least 3 to 4 hours long. When you arrive at the BMT clinic, you are greeted by a staff member who will begin the check-in process. You will provide your name and date of birth. You will also be asked a few questions about whether you and those accompanying you have experienced any recent symptoms such as coughing, sniffling, sneezing, etc. This is to protect both you and the other patients in the reception area. You will then speak with a patient service specialist who will review your contact and insurance information and help you complete any necessary paperwork. Please provide your primary oncologist's information so your treatment plan and other records will be available to them automatically. Next, you will be called by a medical assistant who will take your vital signs, ask a few screening questions, provide you with a tour of the clinic, and escort you to a private clinic room. One of Moffitt's specialized BMT nurse practitioners or physician assistants will meet with you to obtain your medical and social history and conduct a complete physical exam. Feel free to ask questions and be sure to share all medical and surgical procedures you may have had in the past. Preparing a list beforehand is helpful if you have difficulty remembering the details. Be sure to bring a list of your current medications so that we may enter them into your medical record. Please include any over-the-counter herbal medications and supplements you are taking. Your allergies and smoking history will also be noted. Once your history and physical are completed, the nurse practitioner or physician assistant will return to the team room to discuss your case with the BMT doctor. We do this to ensure that we have all the necessary facts, as well as a correct timeline for any treatments you may have already received. The BMT doctor may also use this time to contact your primary oncologist, further discuss your case with other BMT doctors, or obtain any pathology or testing done at another facility that is vital to your medical case. The BMT doctor meets with you once a plan has been developed. Doctors will often review your history again and discuss the possible risks of the procedure, as well as statistics for patients who become cured or are in remission following a transplant. Please do not hesitate to ask questions, especially about the rates of cure and how much risk is involved. Let us know any concern you may have about the transplant process. Your BMT doctor will discuss the type of transplant you may need, as well as other details important to your care. This could include your need to receive additional chemotherapy with your primary oncologist, obtaining medical clearance from other physicians, such as your cardiologist or gynecologist, and the need for dental clearance. Your BMT doctor will ensure that all of the questions you have at this time are answered. Your doctor may also speak with you about participating in a clinical trial. Clinical trials are very important in cancer care as they can lead to new or more successful treatments for patients. Please ask your doctor any questions you may have about clinical trials, including which ones may be right for you. After meeting with your BMT doctor, you will meet with your transplant coordinator. This highly trained BMT nurse will be your main guide and primary contact throughout your transplant. Your transplant coordinator will provide you with information about the transplant, discuss the steps you will need to take to get to transplant, and will always be available to answer any questions you may have. If the doctor recommends a transplant, you will receive information about what to expect next and when the process will begin. The doctor may also request that blood work be taken at this time. Not every patient who has a consult visit will receive a transplant. Your doctor will speak with you about reasons why a transplant may or may not be the best treatment for your condition. You may also meet with a BMT social worker during your consult visit. This professional is an excellent resource to assist you with coping with the challenges before, during, and after transplant. Social workers are a vital part of the transplant team. By the end of your visit, you will have been given a list of items to address on your own in the days, weeks, or months following your consult appointment. This is a good time to obtain dental clearance and any other medical clearance you may need from other healthcare providers. Your transplant coordinator will initiate the insurance clearance process with the BMT Insurance Department. You will be contacted by your transplant coordinator at a later date with next steps. However, do not hesitate to contact your coordinator anytime with questions or concerns. We understand that the consult visit is a lengthy process, but it is very important for us to get to know you and for you to get to know us. Thank you for allowing us to be part of your care team. You are in good hands at Moffitt Cancer Center.